Awesome. Well, hello everyone. I'm pleased to be here with Matt Jones, Alberta's Minister of Hospital and Surgical Services, along with Jason Nixon, our Minister of Assisted Living and Social Services, as well as Rick Wilson, our Minister of Mental Health and Addiction. We're meeting today to reveal the next steps in our plan to give Albertans the outstanding health care that they deserve. For too long, the system's been struggling. The skilled professionals who run it know that. The families facing agonizing waits for treatment know it, and the same goes for the folks who can't even get the care that they need. We've made improvements in some areas, but more are necessary. This year in the budget, we provided more than $28 billion in healthcare funding. That's an increase of nearly $8 billion from 2019, or 40%. The total budget for healthcare represents also around 40% of the province's expenses. And I raise this because we have made major investments in healthcare already. We've taken steps to ensure investments are targeted where they need to go. And today we are announcing further adjustments to ensure healthcare funding is getting to where it is needed. We will provide these additional investments and adjustments through our new Acute Care Action Plan. This plan delivers short, medium, and long-term improvements. It starts with targeted investments for immediate relief of the worst pressures, and this means hundreds more beds, tens of thousands of extra surgeries, and expanded emergency and community care services. Along with shorter waits, less crowding, and faster care, it means growing the healthcare system so it can cope with a larger and older population. There are 6 points to the plan that we're announcing today, including capital planning to add over 1,000 new acute care beds in Edmonton and Calgary, delivering 50,000 additional surgical procedures over the next 3 years, making targeted investments at the Royal Alexandra Hospital to improve triage processes and optimize patient flow, which will ultimately extend to other hospitals as well. We will also be increasing the number of community care spaces. Further announcement will be coming in the coming weeks on that. But we are also going to be including 12 new psychiatric beds and 30 temporary beds made permanent. Led by the Minister of Assisted Living and Social Services, plans are underway to significantly expand, as I mentioned, continuing care spaces. And we're also developing a provincial neonatal intensive care unit strategy to ensure Alberta has the capacity needed to care for our most vulnerable infants. Our Acute Care Action Plan is about putting patients and providers first, and that's why we've refocused healthcare. It's why we've put so much effort into helping it work better. Problems are meant to be solved, not tolerated. We will fix the challenges that hurt Albertans. We will come through for everyone who's suffering from the overburdened healthcare system. And now I'd like to ask Minister Matt Jones to explain the plan in greater detail.
Thank you, Premier Smith, and thank you to the South Health Campus staff, healthcare workers for joining us today. Our government is taking decisive action to strengthen Alberta's hospital and surgical services while improving access to care through the Acute Care Action Plan. This plan includes immediate targeted investments to greatly expand hospital capacity, perform additional surgeries, relieve pressure on our emergency departments, and improve the patient experience across Alberta. First, I'm pleased to share that planning is now underway to add over 1,000 new hospital beds in Edmonton and Calgary, including 2 new hospital towers at the Grey Nuns in Misericordia in Edmonton and a bed tower here at the South Health Campus Hospital in Calgary. Essential new spaces that will give hospitals more capacity as they've been seeing increased demand in response to a rapidly growing and aging population. This is, of course, in addition to other major projects like the Red Deer Regional Hospital Centre redevelopment and our plans to build 8 new urgent care centres. We are also adding 50,000 additional surgeries over the next 3 years to our already record surgical program by expanding hospital operating room capacity and partnering with chartered surgical facilities, ensuring more Albertans receive timely surgeries within clinically recommended wait times. At the Royal Alex Hospital, where pressures remain high, we are investing to improve patient flow, reduce wait times, and support better outcomes. Learnings from targeted initiatives at the Royal Alex will and already are being leveraged to other hospital sites. In partnership with the Minister of Mental Health Addictions, the Acute Care Action Plan will increase treatment capacity, including 12 new psychiatric beds and 30 temporary beds that will be transitioned to permanent beds to ensure patients receive the community support they need. These beds will complement the more than 700 new addiction treatment beds that Mental Health and Addictions has planned for Alberta's 11 recovery communities, with over 270 of these beds already online and treating clients. And in the coming weeks, some big news will be announced on a significant expansion of continuing care spaces across Alberta, another critical step in improving patient flow and freeing up our hospital beds. Hundreds of people in hospitals who are designated alternate level of care are waiting for these spaces. By transitioning them to more appropriate care settings, we free up our critical health hospital capacity. The Acute Care Action Plan will also address neonatal care pressures through the development of a province-wide NICU strategy to support Alberta's youngest patients and their families. While the Acute Care Action Plan takes immediate steps to relieve pressure on hospitals, it also creates a foundation for sustainable long-term change. Its 6 strategic priority areas will modernize care delivery, strengthen system performance, and improve outcomes for all Albertans. First, we are expanding surgical access. By utilizing chartered surgical facilities for routine procedures and investing in hospitals to focus on additional urgent and complex surgeries, we will increase province-wide capacity, reduce wait times, and improve access for patients across Alberta. Second, we are modernizing our emergency health services. This includes expanding our ambulance fleets, implementing better dispatch coordination, and improving service in rural and remote communities. These changes will ensure faster response times and allow paramedics to focus on delivering care where it matters most, at the scene of an emergency. Third, we are improving patient flow and discharge processes by redesigning care pathways, integrating hospital command centers, and setting consistent discharge standards. We'll reduce unnecessary delays and free up hospital beds for those who need acute care. Fourth, we are supporting our healthcare workforce. Through long-term workforce planning, modern deployment models, and new incentive programs, we will ensure that physicians, nurses, paramedics, and our other allied and health professionals are positioned where they can make the greatest impact, working efficiently and effectively to meet patient needs. Fifth, we are strengthening access to care in the community by expanding primary care, urgent care, community care, and virtual care options, and by developing a patient wayfinding portal. Albertans will be better connected to the right level of care without always turning to emergency departments. This will improve efficiency and provide better care for Albertans. And finally, we are planning for Alberta's future. A 50-year capital strategy will align new health infrastructure with demographic growth, ensuring that hospitals and community facilities evolve to meet the needs of our growing and aging population. These 6 priorities represent a clear path forward, a stronger, smarter, and more responsive health system designed to deliver better outcomes for every Albertan. And the significant investments in hospital capacity, community capacity, and surgeries will greatly strengthen our healthcare system over the coming years. Thank you.
Thank you, Minister. We'll now enter the media Q&A portion for the announcement. We'll start off with questions here in the room before making our way to the phones. There's just a mic at the far side here. Reminder to please state your name and outlet before asking your question. And with that, we'll go to our first at the mic.
Hi there, my name is Leah Mushet for the Western Standard. Actually, my question is for Premier Smith. So basically, the 9 federal laws that you said were impeding on in the oil and gas sector, you said your deadline was Sunday, so for the Grey Cup. Since it seems like the federal government is not going to meet your demands, what are you going to do in response to that?
We're still hopeful that in the next few days we'll be able to announce that we've come to an agreement on a memorandum of understanding that not only addresses the need for a bitumen pipeline to Asian markets, but the Pathways Project, and addressing substantially the 9 bad laws that are impairing our investment climate. We've been going back and forth in some detail over many, many hours over the last couple of weeks. But I would say that we just need to give it a few more days to iron out a few more details. And if we have something to report, we will let you know.
Okay, and I guess to go along with that, do you think if you do announce something, it'll be pretty soon?
It would, I would say it has to be before the end of the month. The Prime Minister, I've made it pretty clear to him that there's an urgency to coming to terms on these issues. We know that there are a number of different projects, whether they're AI data centers, or whether it's the expansions that have been announced of existing pipelines and oil sands projects. They need some certainty of knowing what the future is going to look like. So I think in anticipation of that, we're beginning to see the kind of projects that the private sector would put on the table if we can get some certainty. And so I would say I was hoping for Grey Cup, but if it takes just a few more days, then I think that that Albertans will be satisfied with that.
Okay, thank you.
Yeah.
Thank you. We'll go to our next at the mic.
Drew Strymek, Global News. I guess with this announcement of all these additional beds that are going to be put in place, maybe this is for either or any of the ministers, who is going to work these beds? We've got a 98% strike vote from the AUPE. They're looking like they could be going on strike as early as next Thursday. We've got the documents from HSAA saying that more than 30,000 overtime hours are being worked by Alberta paramedics each month. Just wondering, the beds are great, but who's going to be working those beds across Alberta?
Thank you for the question. Obviously, we can't provide healthcare without our talented healthcare professionals. The good news is we have successfully recruited or onboarded 1,000 RNs, LPNs, and healthcare aides over the last year. We've successfully recruited over 600 net new physicians over the last year. And Alberta continues to be one of the best places in the world to live, work, and raise a family, and that includes in our world-class institutions like our healthcare system. So I'm optimistic. I think the value proposition here is significant, and I think that the investments today show that the government is committed to strengthening and building on our already world-class public healthcare system, and we're going to continue to do that. You're going to see even additional healthcare related announcements in the next 30 days, 2 very significant investments in the next 30 days. So I think those are the reasons that I'm optimistic we'll continue to lead the country really in attracting healthcare professionals.
And do you feel like you're making a dent in that program?
I'll just add, one of the things that we observed is that in our charter surgical centers, they have really increased the number of surgeries that they've been able to perform since 2019, going from about 40,000 a year up to 65,000 a year. And so when we went out and asked not only our public hospital providers, but also surgical centers, do you have room to do more? Their answer was overwhelmingly yes. I spoke to my orthopedic surgeon group in Medicine Hat. They are only granted 6 days a month of operating room time. They say that they could probably have enough to do, enough surgeons that they could be in the operating rooms every single day. And so that's why we're adding additional incremental dollars in order to pay based on the surgeries performed. We found that model works, and we believe that we're going to be able to use existing capacity to expand that out further.
And I guess just further on that point, the AHS website saying 26 locations from Athabasca to Wetaskiwin having some sort of reduction in services. 26 for 26 locations saying clinical personnel shortages, the majority of those being in either emergency rooms, acute care, and the vast majority being in obstetrics, so delivering newborns here in the province. How are you guys addressing that shortfall?
Yeah, so in all of those cases, of course, we have contingency plans where patients can be serviced at a nearby health center, and EMS is on standby to transport them, say, to a regional hub. Staffing across Canada is challenging. We're all competing for the same talented workforce, but as I highlighted earlier, Alberta is making progress on not just recruiting the nurses. The shortages you referenced, about 40% of those are the result of a lack of physician coverage, about 40% are nursing or other related staff, and then the balance is a combination of shortage of both. And these are challenges not just seen in Alberta, it's anywhere in Canada where you're dealing with more rural or remote areas. We are making progress in recruiting. We are setting up new incentives, new bursaries to train people in those areas because they're more likely to stay and live and work in those areas if we do so. So we're approaching this from all different angles. It's a difficult problem to solve, but we're also looking at innovative solutions like expanding the scope of our professionals. So what more can paramedics do, nurses, nurse practitioners? How can we keep those emergency departments open through, for example, our virtual emergency physician pilots? And again, it is a real problem, and it's an all hands on deck matrix of solutions that we're working on.
Thanks, Drew. We'll go to our...
I just add one thing to that I hope is not lost in this announcement. One of the key components of what is being announced today by the minister is a recognition that on the continuing care side, on the assisted living side, as we bring on more capacity, that requires staffing, and that's part of this announcement, recognizing we have to invest in both to make sure it takes place. And some of the pressures that Minister Jones is seeing elsewhere in the system is being diverted to staff clients that we should be caring for over in assisted living. And so as we bring on more capacity, we bring on more staff, we're alleviating some of that pressure in the system without having to bring on more staff into the acute care system, because that staffing need is obviously more expensive just because of the nature of how you operate a hospital, how acute care works. And so it's a very key part of this announcement, is a recognition by the government that we have to create new spaces for continuing care patients, and that comes with significant investing in staff long-term in that space.
Go ahead.
Hi there, Mark Villani with CTV. A question for the Premier, unrelated. I wanted to ask about the latest numbers for COVID shots. Right now we're at 4.6% of Albertans who've gotten one. That's down from 14% the same time last year. Just what's your reaction to the lower uptake and the frustration from Albertans who are now required to pay for this vaccine, that group?
Well, I'm not sure you're comparing apples to apples, because the 14% would have been the entire COVID season. We go from sort of end of August until end of August when we're looking at our respiratory virus season. So last year, that entire year had a 14% uptake rate. My understanding is that we're over 190,000 COVID shots so far, and I think that that's consistent with where we were last year. We also have a higher number of influenza shots, and influenza sounds like it's going to be particularly problematic this year. I've been reading some of the news stories around that. So we're making sure that all of the different types of vaccines are available. We also have, we started covering RSV for those 75 and older a few years ago as well. But we are monitoring it. There's a website every day where we can look and see what the latest outbreaks are. At the moment, I think we have more patients hospitalized because of influenza than we do COVID. So it's as we get into the respiratory virus season, we always end up with this kind of impact. And so we're hopeful people will take the precautionary measures.
Just another question here. I wanted to ask you about this morning. There was a press conference with Gil McGowan, his AFL presser. He made some allegations regarding the UCP government deliberately underfunding Elections Alberta to undermine their own recall legislation. I just wanted to get your reaction to those comments that Gil made this morning.
Well, I think Gil McGowan's made it clear he's trying to overthrow our government. Like, that's the wording that he's using. And what we're hearing from the elections officials is just to be able to affirm the signatures in a single petition is 1.1 million, let alone then the second stage of running a recall election, let alone the third stage of running a by-election. So his stunt is potentially costing $5 million for every riding that he's doing it in. And we have to look at that and say, is that really what was the intention of the legislation? And the answer to that is clearly no. The intention of the legislation was to have an opportunity between elections, if there was genuine wrongdoing on the part of an MLA, to have their constituents address it, not some union boss organizing it from Edmonton. So the legislation is also very clear that this is not meant to have people being bussed in from outside the riding and money being raised on GoFundMe from who knows where. So I would say that he needs to check whether or not he's following the legislation, because from our look, it doesn't appear to be. So that's what we're seeing, is that somebody is playing around with, I think, what is a legitimate process and making a mockery of it, quite frankly.
And next up the mic.
Hi, Bill Graveland from Canadian Press. Premier, any thoughts or concerns about Canada losing its measles elimination status?
It is concerning. I've been watching this for some time. I gather that there were 6 or 7 provinces that had a difficulty with measles this season. We know that our first ground zero case happened, I believe, at a wedding in Ontario. And there are a couple of different communities, our Hutterite communities and our Mennonite communities, which do tend to have a lower vaccination rate. We did do some targeted campaigning to increase the vaccination rate. We were quite successful. We saw an uptake, a 50% uptake in the number of measles vaccinations in some of those communities that tended to be have a lower vaccination rate. And I'm glad to see as well that the numbers appear to be abating. I think the last time I looked, we still had an outbreak of a handful of cases. And so I know it takes a 12-month period before you're measles free, before you can get that status back. I think our outbreaks began somewhere in March. They were a lot earlier in some of the other jurisdictions, but I think it's up to everybody to be vigilant in trying to make sure that this disease doesn't spread. It can have devastating impacts, especially on young kids, and so we want to make sure that everyone knows it's available. We made micro doses available for those who are underage as well. We made sure that we put messages out there that women who are considering getting pregnant should also make sure that their vaccine status is up to date, because once they're pregnant, they can't get the vaccination. So we've been doing a pretty comprehensive campaign on targeting that message.
Can you think of anything other than the campaign that could help regain the status?
I think really at this point, because it comes in from multiple different sources. Again, in the early days, most of ours was being caused from outside travel coming in. And so because we do have a very open society, we have people who are able to travel freely between Alberta and the rest of the world, travel freely from one province to another. Sometimes, and that's why we made sure everyone knew when an outbreak was occurred, or when a case was identified. We put on our website so they could see exactly what location, judge their own level of risk, if they saw symptoms, able to get it addressed right away. But it seems to us, looking at the data, is that it was concentrated in a number of communities that have a historically low vaccination rate, which is why we started doing some of the targeted campaigns to increase the vaccination.
Thank you.
Thank you.
And we're going to take one more from in person here, then go to the phones. Go ahead.
Hannah Said, City News. Minister Jones announced that 8 new urgent care centers will be built. Do we have a location for them and a timeline?
Yes, we do have locations. So one would be in East Calgary, 2 are for Edmonton, and 1 nearby in Westview or Stony Plain, 1 in Cold Lake, 1 in Fort McMurray, 1 in the Medicine Hat area. And those are all in the planning stage right now, and they will be likely procured as a bundle. Because 7 of these 8 can likely be built to a very similar scope and size, whereas the Calgary one will need to be larger to accommodate the increased density of the major urban center. So all 8 are under planning. We're actually also evaluating a 9th, which would possibly be a combined urgent and primary care center in the Airdrie area to accommodate some of their population growth. And I may have missed Lethbridge in the list there, in the list of 8. But that's where those are going to be.
Right. You also announced that more than 1,000 new acute care beds will be added in Edmonton and Calgary, but it doesn't give an exact figure of how many in Calgary and Edmonton, and there's no mention of Foothills Medical Center or the Rocky View Hospital in that list.
Yeah, so call it, in the Calgary area, you have roughly 2,700 acute care spaces, similar number in Edmonton. These 3 bed towers, again, 2 would be in the Edmonton region at the Misericordia and Grey Nuns hospitals. Those would both be roughly 350 bed towers each for 700 additional spaces for the Edmonton zone. And here at South Health Campus, which already has much of the site developed for a bed tower, would be around a 400 bed facility that would also be tailored to support women's health and neonatal, I believe. So that would be a combined acute care space addition of about 1,100 in the places where we need the most, Edmonton and Calgary. And of course, as many of you would know, these hospitals service patients from all across Alberta, and a bed tower over here can help the Rocky View Foothills with load leveling as required. We can move patients as required to free up space in the other hospitals.
So just to clarify, no bed additions at Foothills or Rocky View, just here at South Health in Calgary?
No, so this is what we're announcing today. We're also looking around the province to develop shelved space. There's also at the Foothills, we're developing 15 NICU spaces, which I think are supposed to open by 2030. So there are expansions all around the province. We're renovating ORs. We're renovating our medical device reprocessing areas so that we can do more surgeries. We are developing the Red Deer Regional Health Center. So in addition to these 3 bed towers and 1,100 spaces, there are hundreds of additional acute care spaces being developed around the province. But the acute and urgent need for significant capacity growth is in the Edmonton and Calgary area, because that's where the majority of the population has settled over the last few years.
Right, thank you so much.
Yeah, that's. We do have another future announcement of another health facility that we'll be announcing later this month, which is another significant expansion of capacity.
Right, thank you.
Thank you. And we're going to head to the phones. Operator, could you put through our first caller, please?
Bell Post Media.
Good afternoon, Premier. Just going back to your negotiations with Ottawa, what do you say to those Albertans who hear, your positive words and your hope for the immediate future, But what do you say to those Albertans who are skeptical that Albertan can get a win? Maybe they're skeptical because of the past history with Ottawa, or because they're skeptical of Carney, or skeptical of Liberals. But for whatever reason, there's skepticism. What do you say to those Albertans who, despite what you've been saying the last while, are skeptical Alberta can get a win? What do you say to them?
I understand the skepticism. We've had 10 years of terrible policy that have impacted our investment climate. We have $500 billion, we calculate, that left the province to go elsewhere. And that represents jobs. It represents government revenues that would be used to pay for the important priorities of Albertans for social services. And I think it represents a lot of pain from an affordability point of view. It prevents us from being able to do some of the important things we need to do as a government, and people feel that. And we had 10 years of bad policy. We've been in a real fight, particularly for the last 6 years, but I've been involved in this fight directly for the last 3 years, and I can understand people are getting tired and weary and disappointed and frustrated. I understand all of that. But I also know that Albertans want me to try, that we're proud Canadians and proud Albertans, and we want the country to work the way it has historically and the way it's supposed to. And so I've got to do everything I possibly can to try to address these terrible laws that have impacted our ability to develop our resources. And I'm going to keep on doing so until I can tell Albertans, sorry, it's not going to work. And I'm not at that point. I'm feeling really optimistic. I feel very hopeful that we've made a breakthrough, and we'll know more in the next few days. But I would just ask for a little bit more patience, because it has been a long haul. I know, again, people are justifiably skeptical, but I think they might be happy if we land this arrangement that we've been working on so hard for the last couple of weeks.
Well, and speaking of this arrangement or agreement, obviously it hasn't been agreed to yet. But whatever the agreement looks like, is this agreement? Will this agreement lead to A, a pipeline to the West Coast, and B, the overhauling or repealing of the bad laws? Or, in the alternative, is this going to end up turning out to be an agreement to get an agreement on those matters?
Well, I can tell you that we are well underway on the northern BC pipeline proposal. I just got an update on that this morning from our project management office that is working through the technical details, and they're moving quite quickly on it. I also got an update from our Indigenous Relations Minister, who has spent a good deal of time in British Columbia and is going to do more. She's going there again at the beginning of December to begin talking about the equity stake that First Nations bands along that route would be able to take part in. So we're doing our work to make sure that there is a project ready in time that we'd put in the early spring. So that's our intention, is that we will put forward a project proposal for a new 1 million barrel a day bitumen pipeline to Asian markets. We are working with the Pathways Group to develop a program to have a lower emissions barrel going through that pipeline. And the only way we're going to stimulate the investment that we need is to get rid of the bulk of the 9 bad laws or rewrite them. So it's a comprehensive package, and if we're able to come to an agreement, you'll hear about it in the next few days. If not, we'll also tell you that too. But we're very, very close, I think, to having a breakthrough on that.
Thank you. And we have time for one, maybe 2 more questions. Operator, could you put through our next caller, please?
Sarah Reed, CBC News.
Hello. Thank you for taking my question. My question is actually about the tuberculosis outbreak that we're seeing in Edmonton right now. So many health challenges like TB are a symptom of the lack of resources for people experiencing homelessness, which is the population that we're seeing the outbreak in. How is your government planning on addressing those healthcare needs for folks which experts say are contributing to this outbreak?
For a more detailed update on the tuberculosis situation in Edmonton, Minister LaGrange's ministry is probably the best spot to give you detailed numbers. I could speak as the minister who's responsible for homelessness in the province. We're working very, very closely, particularly in Edmonton, with our partners in primary care to make sure that we're getting adequate primary healthcare resources into all of our shelter system. Of course, our signature piece being the Navigation Center, which has primary care staff that work there each day side by side with our staff that are providing healthcare needs. We've also been expanding the Center of Hope's medical shelter to both support Minister Jones's work in alleviating pressure in the hospitals for those who are not in acute care need but still need some primary care healthcare work to take place. So we're doing that in partnership with Minister Jones and Minister LaGrange. And we're continuing down here in Calgary through our partnerships with organizations like ALEX and CUPS to make sure that we're putting in appropriate medical teams that are working side by side with the men and women who work each day to be able to provide shelter and care to the homeless population in both cities.
And then just a follow-up with regards to the changes made to AHS as well as Primary Care Alberta. From a media perspective, we also heard from experts and doctors who have been involved in this that there has been a significant delay in the ability to get the information out to the public, as this outbreak was actually announced back in October, and then the information was not released until last week and was not sent out publicly to media until yesterday. There's also been quite a bit of delay in terms of being able to actually speak to experts on this matter. Curious about what is being done about the sort of chaotic nature of what's happening behind the scene with the lack of approval.
I would characterize behind the scenes as quite collaborative. In fact, we have Primary Care Alberta, Assisted Living, Mental Health and Addictions, and hospital and surgical health services working together on challenges across our healthcare system every day. We work as the acute care arm. We work in collaboration with primary care on, of course, prevention, but we also work with them on transitioning people safely back to the community after their acute care journey is done. So I would encourage you to contact Primary and Preventive Health Services for additional information on your question. But for sure, when there's any type of outbreak or any type of emergent issue, we do collaborate and we try to get ahead of it and make sure that people are safely transitioned back to the community.
Thank you. And that's all the time we have for questions today. Thank you, everyone, for joining us.